Good morning, this is Dr. Mary Brown Bates. This is not personal medical advice, nor is this the opinion of my employers. This morning we're going to be talking about kind of how I think about it when I am, or what I do when I'm starting to think, this patient may have dementia. Things that look like dementia and are easily reversible. The loons have opinions this morning too. There is a loon that's going to be swimming behind me over there sometime soon, I hope. We'll keep our eyes peeled for it. So, when it has crossed my mind that a patient may have dementia, the things I think about that are easily reversible dementia lookalikes are, think about, could they have, you think about their thyroid, so you check their thyroid hormone out. Yeah, that's what we're told. I've honestly never seen a person with thyroid disease so severe that it impacts their thinking to look like dementia. I've seen people with, in particular, actually both hypo and hyperthyroidism, where it affects their thinking, but not where it looks like dementia. But that's what we're told, so I do it. Because boy, if you can find something that's easily fixable, that's exciting. The next thing that I check is, this is a blood panel, so you do all of them at once, of course. An RPR, which checks for syphilis. Again, I have found that has been positive once in my career, and it was a false positive. The patient had already been treated. So, it wasn't a false positive, it was a true positive, but the patient had already been treated. So it was, all those RPRs I've ordered, nothing's ever panned out. I looked it up recently just for curiosity, and it turns out, so my patients that, we're talking about are roughly 70 now. And these are people who were, having their sexual promiscuity times in the early 70s. The rate of syphilis in the population at that point was about 40 per 100,000. So, which is actually kind of similar to what it is now. And a couple of interesting things about syphilis, that's not what we're talking about, but kind of interesting, is the prevalence of syphilis declined until about 2000, 2005 roughly, and it's been going up since then. The other thing, which is really kind of alarming, is that there are now significant numbers of cases of congenital syphilis, about over 2,000 per year in the U.S. That's kind of a lot, for something that's preventable. But anyway, you can hear that. So, check for syphilis, because that's another thing that can be treated that can cause people to sometimes not think as well as they would normally. I don't know. They tell us it can be confused with dementia. So I don't know. I've never seen it. The next one I have confused with dementia, and that is B12 deficiency. And B12 deficiency doesn't even have to be let's back up a level. So there's no manual that says, the normal range for B12, is, 250 to 1,000. There's no manual that tells us that. The way they determine those is, they get, I don't know, 1,000, 10,000, whatever, people who are apparently without disease. That's the key point, apparently without disease, and they check their levels. Then they find the mean, they find, I don't know what it is, 3 standard deviations, and they call that normal. So, very interesting, huh? We've recently discovered that people who have a B12 at the lower end of normal may actually be deficient and may actually have symptoms from B12 deficiency. Isn't that interesting? So, um, I had a patient that I thought, oh my goodness, you have early dementia. Let's let's do the labs that I'm talking about now. We did the labs. Her thyroid was fine. His test for syphilis was negative, but his B12 was low normal. It wasn't even overtly low. It was low normal. It was like, say, the lower limit is 250, and his was like, I don't know, 325, something like that. So, I had her supplement B12, and really interestingly, and 4 months later, when this patient came back for their follow-up appointment, whatever, I don't know what it was, the patient told me, I asked the patient if they had noticed a difference on the B12. I knew the answer because I had noticed a difference already. And the patient said, yes, I've noticed a huge difference. And what's more, I talked with my children, and they said that they were having conversations behind my back about the fact that I was going to need to move to an assisted living soon. And then I seemed to just turn right around when I went on B12. So there you go. That is a case of B12 deficiency looking, to me, exactly like dementia. So, does this mean you should rush out and buy a bottle of B12? No. But it does mean that it's worth being sure you don't have a B12 deficiency. So those are the things that look like dementia and aren't, and are easily reversible. The other things I check when I'm wondering, do you have dementia, are I check the person for diabetes if I have not done so already, because, of course, having an elevated sugar is really bad for your brain and increases the risk of, microstrokes, which contribute to dementia. And I also check their cholesterol at this point, same reason. And try to, fix those things if they need fixing. Obviously the best way to fix your sugar, the best way to lower your sugar and lower your cholesterol, if you can do it, is to diet, exercise, clean up your diet, stop eating the cupcakes or whatever. But, really, if you could do that, why are you in this position now? Like, if you could do that, why haven't you done it? For the most part, most of my patients who are overweight, that they know they're overweight and they've been working on it and have not had success. About 20% of the patients I will have this conversation with, and they will suddenly, this will be, talking about an assisted living will be enough to get them to get their act together, and they will lose the weight and fix their cholesterol and fix their sugar, and, things will go along merrily. The vast majority of the patients will tell me they're going to, and maybe they'll do it for a while. It's hard to have people, so we'll say, okay, let's check your labs in 2 months, see how you're doing, do a weight check in 2 months, see how you're doing. We do a nurse visit, not a doctor visit, because a doctor visit has a copay. Who wants to pay $20, to be weighed? So, already people are like, oh, well, it's a nurse visit. I'm just going to no-show this nurse visit. I'm not going to answer the phone when my doctor calls. And if you think I'm kidding, just talk to my secretaries. Then we send you a letter. And, at your next physical, you've lost weight and gained it back, or you haven't lost weight at all, and now we've wasted a year. So sometimes I just encourage people, or not sometimes, always, when I find an elevated sugar or an elevated cholesterol, I encourage people, how about some medications? Because that doesn't require these complicated follow-ups that sometimes don't happen, even despite our best efforts. So, I don't know. Then the other thing I often do when I have a patient that I am thinking, if the lab tests don't pan out and I'm thinking, oh, you are not thinking well, I'm worried that you have dementia, I will often do a head CT at that point. What I'm looking for is two things. I'm looking to see, has this person had a lot of tiny strokes, in which case we will double down on, you know, exercise, weight loss, cholesterol management, blood pressure control. The other thing that you see every once in a while is a person with brain loss in a particular area, and that can point one towards a particular kind of diagnosis, a particular and even worse degenerative neurological disease. So, yeah, this is not pleasant stuff. Of course, you know this. This is why you've been avoiding the conversation about your memory with your doctor, because you know it's not a fun conversation. Anyway, that's enough for today. Thanks for listening. It's a beautiful morning. Enjoy what you've got, because you never know. You never know when your memory might start to fail. Yeah, great, huh? How about that for a uplifting message? But if we lived forever, it wouldn't be special to be alive right now. Thanks for listening. Have a great day.